Do you ever wake up in the middle of the night and then panic thinking, oh my God, I'm awake again. How am I going to function tomorrow? Most of the time, people believe that these nighttime awakenings mean that something is wrong with their sleep, or they've been told that it's cortisol or hormones. But the truth is that middle of the night awakenings are actually normal. In fact, they're built into our biology. I'm Dr. Nishi Bhopal. I'm a sleep doctor and psychiatrist. And in this video, I'll show you why these awakenings happen and 3 ways to respond so you can drift back to sleep without the panic. Step number 1 is to normalize those middle of the night awakenings. Waking up in the night doesn't mean that your sleep is broken. Sleep naturally has lighter and deeper stages, and brief awakenings are part of healthy sleep architecture. From an evolutionary standpoint, humans often woke up at night to scan their surroundings for safety, looking out for predators or intruders, and then went back to sleep. It's a survival mechanism. So when it happens, remind yourself, this is normal. My brain is doing what it's supposed to do. I'm safe. You can even lean into the moment. Notice how comfortable your pillows are, how quiet it is. Nobody needs anything from you right now. This is your time. What I don't want you to do is to turn this into productivity time. Resist the temptation to check your email, scroll on your phone, or start solving problems. That's going to keep you more awake and actually keep those middle of the night awakenings going. Step number 2 is don't fuel the frustration. By the middle of the night, your sleep drive is lower, so it often takes longer to fall back asleep. The real problem isn't the awakening itself, it's the frustration. Conventional advice from CBTI, or cognitive behavioral therapy for insomnia, is stimulus control. The recommendation is that if you're awake for a while, you get out of bed and do something quiet in low light until you feel drowsy. And that can work, but it doesn't work for everyone. For some people, getting out of bed in the middle of the night actually makes them more awake. I know that's true for myself and a lot of the people that I work with in my practice. So if that's you, don't worry. The alternative is to simply rest. Let your body lie still, do some relaxed breathing, or maybe a gentle body scan. Focus on resting, but not trying to force sleep to come, because that simply doesn't work. The paradox is that the harder you try to fall asleep, the more elusive it becomes. Like in the last video, we talked about learning to swim. If you're thrashing around and trying to make it happen, it actually makes it harder. Learning to let go and float is going to help invite sleep in. Trying harder to sleep is known as sleep effort, and that backfires every time. So whether you decide to stay in bed and relax, or if you decide to get up briefly, the key is to keep it calm, stay in low light or darkness, and let go of the attachment, the pressure to fall back asleep. If you could use some more support with that, whether you struggle with sleep yourself or you work with patients or clients who do, then join my free masterclass on how to quiet a racing mind and sleep through the night. The link to that is right below this video. Step number 3 is to rule out medical causes and support your sleep physiology. So of course, not all awakenings are the same. Sometimes they can be a sign of something medical. For example, sleep apnea can cause repeated awakenings at night. And it's a misconception that only overweight males can get sleep apnea. Women, children, people who are thin, people of all ages, shapes, and sizes can have sleep apnea too. Restless leg syndrome and periodic limb movement disorder can also cause fragmented sleep without you realizing it. Blood sugar dips, also known as hypoglycemia, can also wake you up at night. One way to help this is by having a small high-fiber, low-sugar snack about an hour before bed. For example, veggies with hummus or a few slices of apple with almond butter can help stabilize your blood sugar overnight. And for women, perimenopause and menopause are very common times for awakenings due to hormonal shifts, and there's also an increased risk of sleep apnea during this time. So if your awakenings are frequent, prolonged, or come with other symptoms like waking up gasping, snoring, morning headaches, night sweats, it's worth getting that checked out. So remember, middle of the night awakenings are normal, they're part of human sleep architecture, and they even serve a survival purpose. What matters is how you respond. Step 1, normalize them. Step 2, don't fuel the frustration. Rest, don't wrestle with your sleep. And step 3, if needed, take a deeper look at medical or physiological issues at play. Now go watch my last video on sleep anxiety. Often what keeps people awake in the middle of the night isn't the awakening itself, it's the fear that follows.